The buccal nerve block is indicated for pain management of the buccal soft tissue of the mandibular molars. Adequate retraction is critical. If the tissue is not held taut during penetration, it can be difficult to achieve full bevel penetration. You will note in the video the clinician is retracting firmly and identifying the fold distal to the last molar. This location will be parallel and buccal to the occlusal plane. The buccal nerve block is done in combination with the inferior alveolar and lingual nerve blocks. Once the clinician has achieved adequate retraction and stability with the syringe, a combination retraction, including the thumb and index finger, can increase stability. The syringe barrel will be placed parallel and buccal to the occlusal plane. Because this injection typically comes after the inferior alveolar and lingual, it is important to note that full and taut retraction should occur prior to moving from the previous injections to the buccal injection. Extended verbals for the buccal nerve block. Medical history has been reviewed and there are no changes. Vital signs are stable. There are no contraindications for local anesthesia. I will be using 20% benzocaine topical for 1 to 2 minutes. 3% mepivacaine plain with an expiration date of October 2018, and a 27 gauge short or 25 gauge long needle. The injection is the buccal nerve block. This anesthetizes no teeth or pulpal, only the buccal soft tissue of the mandibular molars. The insertion site is distal and buccal to the most distal molar at the buccal fold. The depth of penetration is 3 to 6 millimeters. The deposit site is lateral to the external oblique ridge. Landmarks are the mandibular molars, the occlusal plane, and the mucobuccal fold. The pathway is parallel and buccal to the occlusal plane. The dose range is 0.2 to 0.3 milliliters. Complications, although rare, may include edema, pain at the site, and rarely hematoma. During the injection, communication with patients and faculty is important. Continue to give the patient positive feedback. With the faculty, state when you have reached your landmark. State also when you are aspirating and the results of the aspiration twice. Also, state when you are prepared to deposit your solution.